manager Nimtz and behavioral health consultant Brooke Griffiths. Welcome back to the show.
Good morning.
Thank you. Good morning.
I think last time Brooke was here was during the pandemic.
It was,
right.
yes. It's been a minute.
Nice to officially meet you.
Yes,
It
same.
feels like,
The
right?
mask, right?
So today we're going to talk about stress.
Stress.
Stress. No one deals with stress.
Yeah.
No one
nobody.
is stressed.
Not a single person.
Everyone's comfortable. What is stress?
Yeah. So stress really is a normal response, right? But chronic stress, which is something lasting months, weeks, that can really harm our physical and mental health.
Okay.
It's linked to things like high blood pressure, weakened immune functions, sleep issues, of course, an increased risk of anxiety and depression. 77% of people say that stress affects their physical health, and 73% say it impacts their mental health.
That's significant.
So it's very significant,
Wow.
Absolutely.
Yes, and stress doesn't just affect one person. It ripples out into families, workplaces, friendships, relationships, all of those things. And so some examples of that, we'll take my boss for example. At work, if he's stressed, I may also be feeling that trickle-down effect, and so on and so forth. You can kind of feel the energy off people. At home, it can cause you to be less present with your family members, again, affecting your relationships, maybe with your children.
Sure.
You're not as patient, and that can cause some emotional regulation issues, difficulty parenting, and as big as the community level. So when stress levels are high in general, we're all feeling it. Financial strain, mental health struggles, difficulty accessing needed resources, and so over time that can really impact everybody's well-being.
You're telling us that stress is common. You're not unique.
Yeah.
Like you said, over 70% in both of those studies. That's amazing. What are some signs that it's becoming an actual problem in your life?
Yeah, so like you said, it is very normal. I think everybody to a certain extent has, even right now specifically, a fairly higher stress level than maybe we're used to.
Sure.
But some signs would be emotionally feeling really overwhelmed. Again, that's normal, but this is overstated. All the time you're feeling overwhelmed. You're really irritable. You might be short with your family or friends, coworkers. Relatable? Yeah.
I'm the least stressed person.
Oh, I wasn't saying recently. I was saying just at some point that may.
Warning signs. That's what we're talking about, right? Yeah.
Right, and pay attention to behavior changes.
So if Bart says something short to me, should I say, "You're stressed"?
You seem stressed.
You seem stressed.
Take
Or
a
will that make it
minute.
worse?
Depends on the person.
Right, yeah. But things like withdrawing from others, changes in appetite, increased substance use. Stress can interfere with work, relationships, daily life, and that's really when it's time to take action.
Stress eating.
You can, that can absolutely. It can show up for a lot of different ways for people.
So, what are some practical ways people can manage stress? Should they take pills?
Yeah. Should they take pills? So that's one. That is absolutely one option.
Yeah.
Well, it's an option.
It is.
But managing stress really, it doesn't have to be complicated. It can be little things. It can be trying something to help you reset, stepping outside, getting some fresh air, listening to your favorite song, maybe doodle, try a creative activity. Exercise is also really, really beneficial for stress. It doesn't even have to be a big workout. Just moving your body, even for a few minutes, can really clear your mind and boost your mood. And then, of course, relying on your supports, right? So talking things out with friends and family, venting, those things are all really critical.
Yes, and I think too, we want to focus on our overall wellness, and that's going to really treat our stress as well. So are we going to bed around the same time, waking up around the same time? Are we moving our body, eating healthy, drinking water? They seem really basic, but those things will really support your stress response, as well as even just focusing on your breathing. Take a moment outside, like Nate said, just resetting.
What type of services does the center offer for folks who want to reach out?
Yeah, so...
Would you like me to take
Yeah,
over?
go
Yeah.
ahead.
So that's part of our role in our support services team, but we do take a whole body approach. So working holistically with the patients at their primary care visits, if that's what they need, stopping in if maybe they scored high on our depression, anxiety screenings, working on short-term brief interventions for mental health. And again, the overall wellness is a huge push. And then we do have therapy. So I do provide therapy as well as that in the moment curbside service like we've talked about before.
Yes.
Are there certain jobs that lead to higher levels of stress? I've heard attorneys is one.
Attorneys, morning show host.
That wouldn't
Morning-
surprise me.
Attorneys is. It
Yeah.
really is.
Right.
Dentists, I've
Yeah.
heard.
Yeah.
So stress isn't just about emotions, right? It can also really be shaped and impact things, like financial stress, housing instability, all of those things. We call those social drivers of health, and they really impact, just like stress, they impact your whole body, they impact everything. So at the center, we do have our community health workers as well. I think I brought a couple on before, but they help with things like finding stable housing, accessing food resources, arranging transportation, and we know that when those things are met, those real basic needs, right, can really significantly reduce stress and improve, your overall well-being.
Brooke, what would you say to someone that needs some help, but you can tell that they're afraid to either ask and maybe aren't sure what the next step would be?
Yeah, I think luckily the stigma is starting to lower, so
Sure.
reaching out isn't as scary maybe as it used to be. But I would say first step is go to your doctor. You can talk to them about it. They can get the necessary resources involved. We, of course, have a lot of integrated care, but I think most doctors' offices are trying to incorporate that. But my biggest advice would be to be proactive and not reactive, right? So we all deal with stress. If we're sensing that things may be becoming a little bit more severe for us, reach out early. It's easier to start it on the front side than on the back end when it feels too far gone.
Sure.
So as a community, we're really stressed during the pandemic. Has the overall level of stress and anxiety improved?
I'll let you take that. What do you
Since
think?
COVID or just like in general?
Since COVID.
Yeah.
I think ups and downs, just like with anything else. I think that COVID really did pose a lot of challenges just in terms of the isolation and a lot of like social anxiety now we're seeing more. So that got more difficult. But yeah, I mean, I think we're on an upward swing, except, the climate is stressful, but things like this and integrated care really help. So
All right, help is available at the Center for Family Health. Good to see you both.
thank
Thank
you.
you, guys.
Thank you.
Brooke Griffiths and Nate Nimtz from the Center for Family Health. More of the morning show after this.